Healthcare in the Republic of Ireland, Wikipedia audio. Healthcare in Ireland is two-tier, public and private sectors exist. The public healthcare system is governed by the Health Act 2004, which established a new body to be responsible for providing health and personal social services to everyone living in Ireland, the Health Service Executive. The new National Health Service came into being officially on January 1, 2005, however the new structures are currently in the process of being established as the reform program continues. In addition to the public sector, there is also a large private healthcare market. In 2010 Ireland spent €2,862 per capita on health, compared to a European Union average of €2,172 per capita. Of this spending, approximately 79% was government expenditure. All persons resident in Ireland are entitled to receive healthcare through the public healthcare system, which is managed by the Health Service Executive and funded by general taxation. A person may be required to pay a subsidized fee for certain healthcare received. This depends on income, age, illness, or disability. All maternity services and childcare up to the age of 6 months are provided free of charge. Emergency care is provided at a cost of €100 for a visit to the Accident and Emergency Department. Healthcare system. The medical card, which entitles holders to free hospital care, GP visits, dental services, optical services, oral services, prescription drugs, and medical appliances, is available to those receiving welfare payments, low earners, and in certain other cases. The only medical conditions carrying automatic entitlement to a card are having thalidomide syndrome, having a surgical symphysiotomy, and children with cancer. Many political parties support extending the availability of the medical card to eventually cover everyone resident in Ireland. They currently cover 31.9% of the population. Those on slightly higher incomes are eligible for a GP visit card, which entitles the holder to free general practitioner visits. For persons over 70 years who are not entitled to a medical card or GP visit card, they instead receive an annual cash grant of €400 up to a certain income. People who are not entitled to a medical card must pay fees for certain healthcare services. There is a €100 A&E charge for those who attend an accident and emergency department without a referral letter from a family doctor. Hospital charges are a flat fee of €75 per day up to a maximum of €750 in any 12-month period, irrespective of the actual care received. Specialist assessments and diagnostic assessments are provided free of charge. If a person cannot afford to pay hospital charges, the house will provide the services free of charge. Under the Drugs Payment Scheme, prescription drugs, individuals and families are eligible for subsidies for approved prescription drugs, medicines, and certain appliances, and pay only a maximum of €144 per month per household. To qualify, a patient must hold a Drugs Payment Scheme card, for which everyone who does not hold a medical card is eligible. Health and Personal Social Services, which in turn is divided into 3 service delivery units: the National Hospitals Office, which manages acute hospital and ambulance services, primary, community, and continuing care, which delivers health and personal social services in the community and other settings, population health, which promotes and protects the health of the entire population. Everyone living in the country, and visitors to Ireland who hold a European health insurance card, are entitled to use the public healthcare system. Under common travel area arrangements, British citizens do not require an EHIC card and can instead present their NHS number, NHS card, driving licence, or other proof of residence within the CTA. Outpatient services are also provided without charge. The majority of patients on median incomes or above are required to pay subsidised hospital charges. Many hospitals in Ireland, such as Connolly Hospital at Blanchardstown, are operated directly by the House. There are also hospitals run under a voluntary basis by organisations who receive public funding but operate with some degree of autonomy. Included in this latter group are teaching hospitals operated in conjunction with a university and hospitals with a long-standing religious ethos, e.g. Adelaide and Meath Hospital in Dublin. There are also many private hospitals. Ireland has a lower than OECD average number of hospital beds according to the 2013 OECD Health at a Glance report. The same report also noted that Ireland has fewer doctors and more nurses than average in other OECD countries. Hospitals in Ireland generally offer a full range of healthcare including accident and emergency services. There have been dramatic reductions in mortality from the three principal causes of death in Ireland: heart disease, cancer, and stroke. In recent years, age-standardized mortality rate for heart disease has fallen by 59% between 1990 to 2011 and now stands just above the OECD rate at 136 deaths per 100,000 population per annum. Similarly, the age-standardized mortality rate for stroke has fallen by 51% in the same period to below the OECD average. Deaths from cancer have fallen by 21% between 1990 to 2011 to 217 per 100,000. Ireland has reduced its spending on healthcare by 6.6% since the onset of the global financial crisis, according to the OECD's 2013 health report. In consequence, waiting times for treatment have increased. According to the Euro Health Consumer Index, waiting times for emergency treatment, minor operations, and CT scans in Irish hospitals in 2015 were the worst in Europe, though the Irish health system was ranked 21st out of 35 European countries. The Health Service Executive accepted that it lacked capacity to provide sufficiently accessible health services. It was working to ensure that no one had to wait more than 18 months for an outpatient appointment, or inpatient treatment. According to the index, reports by patients on waiting times were considerably more pessimistic than official Irish waiting time statistics. 47.6% of Ireland's population were covered by private health insurance, and 31.9% of the population were covered by medical cards. 23.8% of the population over 16 had a chronic illness or health problem. 19.6% of the population over 16 had limited activity, of which 6.6% were strongly limited and 13.0% were limited. 47.2% of the population over 16 described their health as very good, 35.7% as good, 13.5% as fair, and only 3.6% as bad or very bad. 24.9% of the population over 16 were classed as smokers. There were 53 publicly funded acute hospitals, with a total of 12,094 inpatient beds available and 1,253-day beds available. The average length of an inpatient stay in hospital was 6.6 days. In 2007, 76% of inpatients were admitted to hospital for operations immediately, 11% had to wait up to 1 month, 4% had to wait up to 3 months, 1% had to wait up to 6 months and 4% had to wait for over 6 months for operations. Waiting times at the National Rehabilitation Hospital, the only such facility in the country, can be 1 year. For outpatients, 23% were seen on time, 44% were seen within 30 minutes, 18% waited more than an hour and 7% waited 2 hours. In 2007, for GP services, 31% were seen without an appointment, 38% received a same-day appointment, 28% received a next-day appointment and 3% had to wait over 2 days to be seen. Hospitals and health outcomes. The National Treatment Purchase Fund was set up in 2002 for those waiting over 3 months for an operation or procedure, and as a result over 135,000 patients on waiting lists have been treated so far. The NTPF involves the government paying for public patients to be treated for free in a private hospital in Ireland, or sometimes abroad if necessary. The NTPF has reduced waiting times for procedures to an average of between 2 and 5 months, compared to between 2 and 5 years in 2002. There are cases where essential care is needed urgently but not made available by the House under their NTPF, and contrary to relevant judgments by the European Court of Justice. House figures quoted in April 2012 show that at least 178,000 people in Ireland were on waiting lists to see specialists at an outpatient clinic, and that more than 300 patients had been waiting for over 4 years to be seen by a consultant after being referred by their GP. Health centres provide a wide range of primary care and community services in towns and villages throughout Ireland, and are run by the House. Services available at these clinics include GP services, public health nurses, social work and child protection services, child health services, community welfare, disability services, older people services, chiropody, ophthalmic, speech therapy, addiction counseling and treatment, physiotherapy, occupational therapy, psychiatric services, and home help. These services are available free, or at a subsidized rate. Primary healthcare in Ireland is mostly provided by general practitioners, who generally operate as sole traders or in health centres with other GPS and sometimes nurses. Most GPS also offer house visits to their patients, with emergency out-of-hours GP services available in all parts of the country. GPS generally charge on a per-consultation fee basis, usually charging anything up to €80, depending on region. People with medical cards or GP visit cards are exempt from charges. Many GPS also provide free services to those with hepatitis C and maternity and infant services. Those with private health insurance can, depending on their plan, have their GP costs paid or refunded, either fully or partially, by the insurance company. People can also claim tax relief for GP visit costs. Prescription drugs and medical appliances are available to all for a small fee, reduced cost, or in certain circumstances free to residents of Ireland. The drugs payment scheme ensures that every household only has to pay a maximum of €144 per calendar month for up to 1 month's supply of prescribed medicines and medical appliances. Some private health insurance plans provide partial reimbursement up to the drugs payment scheme threshold. Those who are entitled to a medical card pay a government levy for each item dispensed. The levy is €2.50 for under 70s and €2 for over 70s, up to a maximum of €25/€20 per family per calendar month. Those who are suffering from one of a list of 16 long-term illnesses do not have to pay for medicines or medical appliances related to their conditions. Ireland has below-average use of generic medication according to the OECD, despite being a major exporter. All immunization vaccines for children are provided free of charge in schools, health clinics, and hospitals. Recovering heroin addicts can receive methadone treatment free of charge under the methadone treatment scheme. Waiting lists. Health centers. The House provide dental, optical, and oral health care. Medical card holders and their dependents, Health Amendment Act card holders and children get these services free. Other people can get these services free or at a reduced cost from the treatment benefit scheme or private insurance. People who pay the full price to private practitioners can claim tax relief. General practitioners. Drugs. Other services. Payment schemes. Satisfaction with the health service. The House also provide mental health services and treatment and rehabilitation services for alcohol and drug addicts. The Irish healthcare system is often criticised for not providing sufficient services for those with mental health issues, leading to a rapidly growing suicide rate, and ineffective services delivered to young people. Those without a medical card or private health insurance, and their dependents, can receive medical services free or at a subsidized rate from the treatment benefit scheme, which takes into account the compulsory social insurance fund contributions they have made. People can also claim tax relief on medical expenses not covered by the state or by private health insurance. Those with private health insurance are provided with tax credits, which are passed directly to the insurance company and lower the customer's premium. Visitors to Ireland who hold a European health insurance card do not have to pay for emergency treatment from a general practitioner or specialist, emergency dental, oral treatment, inpatient or outpatient hospital treatment or prescription medicines. Those who need dialysis, oxygen therapy, or other specialized treatments can arrange for them before their visit. Health Service Executive. A survey, commissioned by the House in 2007, found that patient satisfaction with the health service was quite high, with 90% of inpatients and 85% of outpatients saying they were satisfied with their treatment. In addition to this, 97% said they were satisfied with the care provided by their GP. The 2008 Health Consumer Powerhouse Euro Health Consumer Index report ranked Ireland's public healthcare system 11th out of 31 European countries. This is an improvement on the 2007 report which ranked the Ireland 16th out of 29 countries, and a drastic improvement on the 2006 report, in which Ireland was ranked 26th out of 26 countries. The Health Service Executive manages the delivery of the entire health service as a single national entity. There are 4 House administrative areas, which are in turn divided into 32 local health offices. The House is Ireland's largest employer with over 100,000 workers, and has an annual budget of €16 billion, more than any other public sector organisation. The House's organisational structure is divided into 3 main areas. The Minister for Health has responsibility for setting overall policy with regard to the health service. Minister for Health. Private health insurance is available to the population for those who want to avail of it. VHI Healthcare, Laya Healthcare, and Aviva provide health insurance, among other services. Devil were set up in 2006 to provide health insurance amongst other insurance types. On July 2, 2012, Glow Health entered the market to become Ireland's fourth private health insurer. In 2005, 47.6% of people were covered by private health insurance. The regulatory body for private health insurance is the Health Insurance Authority. In 2015, the proportion of people buying private health insurance had fallen to 40%, but this is still the highest proportion of any European country. Private health insurance. The Hospital Saturday Fund is also available to give customers cash towards a range of everyday healthcare costs. In 2005. Health statistics. It had the third highest proportion of nurses and midwives per head in Europe, 1,193 per 100,000 in 2015.